How to get an official autism diagnosis. How do you get diagnosed with autism in 2024? This is a question I get all the time, and I've answered it before, but it bears repeating. So in order to get a diagnosis of autism or to be evaluated for autism spectrum disorder, you have to figure out what professional you have in your area that can diagnose you with this condition or evaluate and screen you for it. So I tell a lot of people that the most linear path that you want to take, the easiest thing to do is to find your primary care provider, because if you're lost, you go to your PCP and they'll get you situated. If they can't diagnose you or if they can't screen you for it, they'll send you to the appropriate person. And the primary care provider is a physician, nurse practitioner, physician assistant. This type of person can get you going. And a lot of primary care providers are able to diagnose and screen somebody for autism and ADHD, things like that. When it comes to other disciplines that can diagnose you with this condition, we look into psychiatrists, psychologists, social workers. It's a little bit different based off of the person that you go to. If you go to a psychologist, more than likely they'll do a neuropsychological evaluation. However, you don't have to do a neuropsych evaluation to diagnose somebody with autism. If you go to a psychiatrist or a psychiatric nurse practitioner or a psychiatric PA, they will do a full psychiatric evaluation, and that will look for other conditions: depression, anxiety, ADHD, autism, a full thorough workup. A lot of people think that when it comes to getting autism diagnosis, you have to go to a psychologist and you have to go through this battery of tests. You have to go through all this testing. However, if you look in the DSM-5, they have the criteria for autism. So, like I said, you could go to a psychiatrist who's very familiar with the criteria for autism spectrum disorder according to the DSM-5, and they can talk to you and they can do a psychiatric evaluation. And after 60 minutes or an hour and a half, however long it takes to get the assessment done, they could diagnose you with autism. And at that point, you can begin to get the appropriate resources that you need to get your life, not in order. I don't want to say to get your life in order, but to place yourself in a position to where you can succeed. Because what is autism? Autism is a condition where the way you communicate with the world is different from how a neurotypical person will communicate with the world. So it's a bit different. It doesn't mean that you're worse or better than anybody, but because of this condition, it makes it hard for you to speak up for yourself sometimes. It makes it hard for you to figure out what you need in life to succeed and to thrive. In life, we're all gonna need help in some form, whether it's external help or whether it's help from a family member or a friend. We all need help in some capacity. When you're neurodivergent, especially with autism, you're going to need help. It doesn't matter if I may or may not need help, you will need help. But a lot of times individuals are undiagnosed and you don't know what's going on. So that way you're just flustered. You don't know where to go, who to talk to, or what to do. So once you get this diagnosis, you know, okay, I'm autistic, great. And then you can start to identify the areas that you can improve on. And a lot of times you'll have to get the help from somebody else. Maybe you'll have to get a little bit of help from your school, a little bit of help from work, get some workplace accommodations. You may need to get some help from your caregivers. And at the same time, you helping out other people is something that you have to think about, because it allows you to have autonomy over something. So in life, it's not just we're getting the help from everybody else. Yeah, you do, but you're also helping people out too, because that's a great way to show that you have value, you're good at something, and people appreciate you, which is true without you doing stuff for other people. But is this a great way to remind yourself of the value that you bring to the world? So, in conclusion, when looking for an autism diagnosis, people come to me and say, oh, how do I get diagnosed with autism? And I say, the best thing to do is not to just go for an autism diagnosis. And you may have it or you may not have it, but to go for a full psychiatric workup. And if you ask me, I say the most linear path is to go to your PCP, your primary care provider. If you have a psychiatrist or a psychiatric nurse practitioner, somebody who can assess you, a mental health specialist, even better. but not everybody has that, right? Not everybody is able to have a mental health specialist, whether it's via telehealth or in person. It's not something that everybody has access to. But if you have access to a mental health specialist, I would recommend that you ask for a full psychiatric evaluation. And this is where you get assessed for not just autism, but any mental health condition that could be present. Because a lot of times, it's not just autism that you see. The majority of the patients that I treat don't just have autism. They got a little bit of anxiety, a little bit of depression, a little bit of OCD. I see that a lot. A little trauma, a little bit of PTSD, or a little bit of CPTSD. You could have bipolar disorder. Not to say that you're gonna have all these things, but you could have these things. So the best thing to do is to go to a mental health specialist who can do a full-on psychiatric evaluation and screen you for everything. And if you have autism, great. Well, make sure that you have the proper support in place so that way you're not just trying to get through life and survive, but now you're thriving.